Last year, a Mayo Clinic trained surgeon whispered something to me off camera. He said, if my patients knew how many scripts I write just to buy time, I'd be out of a job. That one sentence sent me digging through 3000-year-old texts, and honestly, what I found made my modern stethoscope feel like a toy. Look, modern medicine is brilliant at trauma, at fixing what's broken right now. But let's be real, it's often lousy at lingering pain. 53% of Americans now live with some form of chronic illness, conditions we casually label manageable, not curable. Translation: you're on a refill for life. Meanwhile, ancient texts from Ayurveda and traditional Chinese medicine sit digitized but largely ignored. The WHO recognizes over 400 conditions acupuncture can treat, yet US insurance only covers about 12. The gap here isn't a lack of evidence. It's a messy cocktail of economics and a collective amnesia about our medical past. First up, let's talk about kitchen gold, turmeric. According to a 2023 Johns Hopkins meta-analysis, it's as effective as 800 milligrams of ibuprofen for knee arthritis without the terrifying gastric bleed risk. Its active compound, curcumin, blocks the cellular on switch for inflammation. So, grandma's golden milk? Turns out it was a dose-measured drug trial, centuries before PubMed even existed. Next, acupuncture. Get this. It actually outperformed morphine in 16 of 17 emergency department pain trials reviewed by the US military in 2022. The catch? An average acupuncture session might reimburse a clinic $28, while an for painkiller can net them over $300. Hospitals aren't heartless. They're just handcuffed by billing codes older than dial-up internet. Then there's the forgotten gut, ancient Ayurveda called digestion agni, the sacred fire, over 2,500 years ago. Today we call it the microbiome. Herbs they used back then like boswellia, ginger, and triphala have been shown to slash inflammation markers by a remarkable 48% in just 12 weeks, according to a 2024 Cleveland Clinic study. If these stats are rewriting my medical protocols, imagine what they could do for your next checkup. Hit that subscribe button because this channel is the memo your physician probably never received. So why don't modern doctors talk about this? It's not a conspiracy. Medical schools, on average, allocate just 19 hours to nutrition across 4 years. While pharmacology claims 250, residency adds 80-hour workweeks with zero bandwidth to learn about traditional healing. Plus, the system rewards procedures, not prevention. If it can't be billed in 6 minutes, it probably won't be mentioned. Here's the thing, ancient systems aren't anti-science. They're pre-science. They built the foundation. The smart move is to integrate. Use trauma surgery for the car crash, absolutely. But then use turmeric and sleep hygiene for the aftermath. Health isn't a war between eras. It's a relay race. Our ancestors passed us batons of invaluable knowledge, and for too long we've dropped them. It's time to pick them back up. Ask your doctor about acupuncture, consider curcumin, and start scheduling meals like their prescriptions. Comment below which ancient therapy you'll research tonight. Share this with someone you know, and join me next week when we decode the Egyptian sleep cure that outperforms Ambien.